We're going to hear from both local and interstate programs that exist at present and explore how we continue to build on that work and consider the doorway service in the West Australian context. We have a stellar lineup of people, including Dr. Donna Turner from Shelter WA, Hayley Bowman from Wellways Housing Program in Victoria, and Daisy Ashworth and Matilda Martin from Red Cross in WA. So without further ado, I'd like to introduce you to Donna Turner from the Shelter WA, who will talk about the program that she's involved in at Shelter WA. So handing over to you, Donna.
Thank you, John. Hopefully you can hear me okay. And thank you for the opportunity to talk about the need, the very great need for additional support for people with psychosocial disability who are renting in the private sector. Thanks also for the acknowledgement of country. The project that I'm working on is statewide. So part of the joy of the project is listening to everybody as they acknowledge country from where they're zooming into our meetings. So I'd like to give a little bit of context. Some people will know this, for some people, hopefully it's new and useful information. So 411,500 people in Western Australia experience disability, and over 90,000 of those people experience psychosocial disability. 60% of those people also experience mobility restrictions, and around 40% of people with psychosocial disability also experience intellectual disability. This data is based on the Survey of Disability, Ageing and Carers. And given the stigma that still exists around psychosocial disability or mental health challenges, these figures are likely to be an underreport. If we look at the experience of renting, 111,000 people with disability are renting, and 70% of those rent in the private sector. Around 25% are in state housing and 5% in community housing. So there's been quite a shift in the private rental market over the last couple of decades. And so what we see now is that people who might be referred to as vulnerable renters and might previously have been able to gain a rental in social housing are now renting in the private rental market. So they experience the same vulnerabilities of being on low and fixed incomes. They don't have access to the same supports needed to sustain their tenancies as might be provided to people in social housing. So the Productivity Commission produced some really useful research that gave evidence, I guess, to what we all know, which is that the population of private renters has really changed. So there's now a growing percentage of people who are renting privately who are in fact, one life shock away from not being able to sustain their housing. So we see an increase in the percentage of people with disability who rent privately, and we particularly see a growing proportion of older people, so people aging into disability who previously would have owned their home by that age, but now remaining in private rentals. So there are a number of reasons for that. I would say the failure of governments to plan for adequate public housing stock means people have to rent privately, even if there is a lack of support for them to sustain their tenancies in the private sector. What this means is that existing tenancy support services now face an increased demand for their service. And a recent report looked at the ability of those services in Western Australia to meet demand, and there were very few that could. So I'd like to tell you about our project. So the Building Tenancy Skills project commenced late last year. It was funded because when we look at the experience of tenants with disability, we see that they're often renting houses that don't meet their needs. They experience distress, and more issues come up during rental inspections. They record more forced moves from rental to rental. So they're not moving because they choose, but because they've been given a notice or they've breached. People with disability also incur greater costs when they're moving. So this increases the risk of homelessness for tenants with disability. And so this project, the Building Tenancy Skills project, is a homelessness prevention project. It's identifying what is it that tenants with disability would like to help them sustain their tenancy. So the photo that you can see now is one of our earlier meetings where we were able to meet in person. This is the co-design team. So it's 13 people with lived experience of disability from across the state. We've come together for 8 months now. Our main deliverable was to design a workshop for tenants who experience disability. And the workshop provides information about people's rights under the Residential Tenancies Act. It provides plain English resources, and it gives people a chance to talk about the practical ways they've learned to deal with the pressures of being tenants whose disability might not be understood by the landlord. So we've adapted over the months. For the last few months, we've all had to work online. So some people meet at a library, for example, with a support worker who assists them to navigate Zoom and participate in the meeting. It's been a great project for understanding the situation from a lived experience perspective. And I mean, that's the beauty, the value and the importance of co-design. So the workshop that has been co-designed will be delivered across the state. Other issues that came up in our work was the importance of awareness of those frontline staff who come into someone's home. So property managers, housing officers, etc. We were keen to work out what training they would receive and what training would be helpful for them to better understand the needs of the tenant. We also decided pretty quickly that we needed to develop plain English and easy read versions of tenancy resources. We love lawyers for their ability to interpret the law, but sometimes when they write fact sheets, we can't necessarily understand everything that's there. So we've looked at some existing fact sheets and put them into plain English and some resources into easy read. We've also realised that there are some great services and some really good community services directories, but they're not always accessible, and the description of the service doesn't always give people a clear idea of what they can expect from the service. So that's something we would like to look at. And then we had a fabulous working group that looked at systemic change. You know, what could we contribute with all of this lived experience to current reviews into the funding of housing and homelessness services? What could we contribute to the current review of the Residential Tenancies Act? And how could we engage with service providers to support them as they're engaging with their clients who might experience disability? So we had some pretty tough sessions in sharing experience. And one of those sessions looked at the risks people felt were the most important to sustaining their tenancy. So this looks like, you know, 5 really simple dot points, but was actually speaking to the experience of a lot of people. So financial hardship meant that people didn't have funds available for tenancy related things like making good on any damage to the property, for paying for gardening or cleaning if they weren't able to do that themselves, for getting rid of rubbish that might have built up, or for paying for the storage of items that the property manager might have said, you know, needed to be removed from the property. The accessibility of the property, that's a term where often we immediately think of, you know, grab rails and ramps, but it's a lot more than that. And particularly for people with psychosocial disability, one of the issues that comes up is our problems around noise and privacy. So a lot of housing, particularly units, there's poor soundproofing. So people are really exposed to what's going on with their neighbours. And I guess one of the important differences between the support available to people in social housing versus those in private housing is that there is actually a requirement in social housing for modifications to be considered to support a person who's experiencing disability. And that doesn't really exist in the private sector. Now, the communication barriers that were identified were manyfold. So the emotional energy required to deal with frontline staff, like a property manager who might be discussing a breach with you, that was something that people felt was often beyond their means and something that they would try to avoid or give in, rather than it cost them so much to have that conversation. But communication is also around the challenge of understanding written information. So if it's not provided in plain English, and I've filled out a residential tenancy agreement, and I'm sure I signed that piece of paper without understanding everything that it was requiring of me. And I certainly don't think I had a full understanding of my rights as a tenant, even though I was signing that piece of paper. So communication barriers are really important and can really isolate a tenant. If they can't communicate with the property manager, and they also find barriers in communicating with the services that could be there to help them. Now, maintenance issues came up as a big thing, and that takes us back to the fact that there is so much co-occurrence of psychosocial and physical disability, and particularly thinking about people aging into disability as well. The last point here is people being unsure of their rights and also their responsibilities as a tenant. And that leaves tenants vulnerable. They're vulnerable in disputes with the real estate agent or the property manager. They might not be clear on whether they really are in rent arrears or not. And, you know, we had an example of where a tenant was being pursued for rent arrears, and she was able to reach out to a tenant advocate and a financial counsellor. And when they accessed the records of her rent payments, she was actually in front, and there'd been an error in how her payments were being recorded. But if she'd not reached out for an advocate, she said she just would have accepted it. So when people don't know their rights and responsibilities, it's certainly not putting them in a strong position to manage issues around their tenancy. So of course we talked about, you know, what support is required to help people maintain that tenancy. So communication around breaches, that is that, you know, actually having those difficult conversations when a property manager has said that you've breached the agreement. When you look at the data that people with psychosocial disability have shared, around 70% said that they would avoid stressful situations. And that can include things like dealing with the property manager. It just takes so much out of people if they feel that power is really unbalanced. Navigating access to services. You know, sometimes people do really well, they get to one service, but they actually need to access multiple services. And having somebody navigate that access is incredibly important, because people can be really fatigued just in making contact with one. And a couple of people in our project have been introduced to peer pathways, which is a service that does exactly that, and available through Comwa. People want support in preparing for rent inspections, and that doesn't necessarily mean they want somebody to come and clean, although it might mean that, but they might want somebody to help them with the logistics. So often someone with disability might need to coordinate with support workers and others in order to be ready for that rent inspection. You know, it takes time, you've got to make multiple appointments with other people, and you're dependent on their availability, which adds to your stress. You know, am I going to be ready for this rent inspection? So having someone even to talk through the logistics of a rent inspection is really important. Having someone there with you when the inspection takes place, if that's what you would like, but just also knowing what your rights are. Decluttering and property maintenance, really important things that people required support about and found it difficult to access, particularly if they're on a low income and not eligible for NDIS. And greater knowledge of tenancy rights. So people feel that if they could access plain English information about their rights as tenants, that they would feel in a stronger position in all of this work that they need to do to sustain their tenancy. So what things worked? Having that person to speak up for you when you are not able to do it for yourself, and being able to trust that advocate to work at your direction was invaluable. That's what people said they needed, not all the time. And the goal, of course, is self-advocacy. But when everything feels like it's stacked against you and it's about your house, then having someone to speak in your corner is really important. Some people said they wanted an orientation to their tenancy. So they wanted time to be introduced to the property. They wanted support with a property condition report. They wanted to better understand who at the real estate agency was responsible for what. They wanted to know which way or how emails or other communications would come through to them. What did a text look like? What did a notice look like? So they really wanted to be prepared for things so that they weren't automatically nervous of every communication that might come from the real estate agency. When it came to making contact with tenancy support services, it was really important to our group that there was a range of ways to make contact. So people talked about the despair of either using a web-based inquiry form and never knowing if they'd get a response, or phoning a service, getting the answering machine, leaving a message and not knowing when someone would get back to them or if someone would get back to them. And matters around tenancy are so time sensitive that just added to people's angst. So they might phone a service again and again and again in the hope that they would actually get to speak to a human. So people did want to have diverse ways to make contact with services, and that also speaks to the diverse needs of people with disability. People really want staff who have some empathy, you know, some life experience, who have an appreciation that the person in front of them is a person and experiences disability. So for some people, that meant staff who were peers or had lived experience, or it meant staff who had relevant training. And one thing people really valued was a service that knew what all the other services were that the person needed. Hub services were actually really valued, but it's often the case, you know, if you're in rent arrears or dealing with some other tenancy issue, that there are other things that you need support for. And people spoke really favourably of well-informed staff who knew where the other services were and how to link them into those services. So what services are actually available? Now, I don't know them all, and I'm still building this list, and I might learn from you today some more services that are around. But these are the ones that people in our project have used and we've been told about, and we're now actually working with some of them as well. So most people would be aware of Circle Green, providing that legal tenant advocacy, and also the community legal centres that have the tenant advocacy and education service around the state. Financial counselling, so important, particularly the advocacy that a financial counsellor can do. But for people in rent arrears, to have the support and the advocacy of a financial counsellor has proved really important to hanging on to their rental. The private tenancy support services, which are mainly based in the metro, really valued, but from our perspective, underfunded, and not always able to respond in the time-sensitive manner that is needed around tenancy issues. So there are public tenancy support services. I'm still learning what they look like. There's also Thrive, which is not available to private tenants, and it's been great to speak to the staff who deliver Thrive and better understand that service. There are also tenancy support services that are provided by individual community housing providers, and it's been great to engage with some of those community housing providers, including the Aboriginal community housing providers, to understand how they support their tenants. There are NDIS funded services. Very few people are eligible for NDIS, but for some of those people, the services can be great, really essential for sustaining their tenancy. There are also organisations, some of the NGOs who basically donate money to their currently underfunded services and assist tenants with things like rent arrears. Consumer Protection has an advice line, and conciliation, although not a lot of people know or think that as a tenant you are a consumer. You're actually buying a service and you should have the rights of a consumer. Now, there's some good research around tenancy sustainment, but most of that research is conducted in social housing settings. There's only a little that's really looked at the private sector. But if I was to sum up, combine what I've read around the research and also as a result of our project, these would be the things that work. Services need significant amounts of brokerage funding so that they can actually be really responsive to the needs of each tenant. Services need to be funded to provide sufficient number of hours to clients with multiple co-occurring needs. And the staff are often under pressure to meet a certain caseload. They're funded for a certain number of hours, and it doesn't prove to be realistic. Staff also need the right skill sets. They need organisational resources to support them, because these roles are challenging. There's a broad range of tasks, and they need to have really good knowledge of other services or know where to find those other services. So what would I think would help with tenancy sustainment, particularly in the private rental market? We need reform to the residential tenancy legislation. Right now, it does not even require that information be provided to tenants in a format that they understand. I would really like it if WA implemented the livability provisions of the National Construction Code. WA is one of the states that has not put in a timetable to do this. I would love it if NDIS participants were provided with really practical advice on how to use their NDIS funding to pay for modifications to a private rental. If anyone's got that piece of paper, please let me know. There's a certificate in housing available in New South Wales and Queensland, which covers a whole range of really useful skills and knowledge. It'd be interesting to have that available in WA, and also for it to be available as a discounted TAFE course. I think there's a real need to support staff in this sector. What else do I think would help with tenancy sustainment? More affordable and accessible housing, because what we see when people are living in housing that's not suitable or accessible is their need for formal and informal supports is much higher. And we need to look at other cohorts of people who experience psychosocial disability. So, you know, currently there's over 150 people in inpatient units in Western Australia who are there because there is a lack of accommodation and supports for them, so they can't be discharged. And I would also advocate for greater lived experience involvement in the co-design of all tenancy sustainment services. And to their credit, a lot of organisations are doing this already. They're moving into that space of lived experience or peer workers. They're co-designing with potential service users. So, and often they're doing that without funding. So it's great. And I'm really excited to see what will come of that work. So thank you very much. And yeah, I'd love to take any questions.
Thanks, Donna. Really useful insights. And actually, I might get you to stop sharing screen and then we can see you. Makes it a bit more personable. Thanks for that. And so, some really useful insights. And I mean, a lot of it is just common sense, really, isn't it, at the end of the day? But I know you're busy and you're needing to go. So do we have any questions from the audience, and do we have any questions from online? You can either unmute yourself and ask a question or put it in the chat. So does anyone have any questions of Donna?
Yes, I do. I'm online.
Yep.
Hi, my name's Louise. It was really great to hear from you, Donna. I work in the NDIS space, and I've noticed it's becoming far more difficult for participants to access funding through the home and living funds, and that the NDIS is now starting to state that it's a normal every living day expense and people are being declined. Are you hearing about this happening?
Louise, I think you've got more detail around this than I have. My experience has been trying to understand how people can use their funding if they need modifications to a private rental.
Okay.
And the mismatch is that NDIS says, yes, you can use your funding if you have long-term tenancy of that property. And what they're saying now is 5 years. If you can show me someone in Western Australia who has a 5-year lease of their private rental, you know, that's amazing, but I think it's pretty rare. So yes, here you have this potential for funding that would help someone sustain their tenancy and also live a better life in their home. But there's that mismatch between state legislation around tenancy and NDIS funding. And so where this is a growing concern is, as I said before, you've got more and more people living in private rentals who experience disability. But, you know, this is something that we're advocating for at a systemic level, but still, if I can find that resource that explains somebody's rights in this space, I'd love to see it. And I have asked many times. But Louise, yeah, it'd be great to catch up and hear more about what you're saying there. So thank you for that comment.
Thank you.
Thanks.
So, anyone else with a question? Anyone in the audience? Oh, sorry, virtually online? Just unmute yourself. Okay, I think that brings it to a close. Thank you so much, Donna, for your time and sharing the information from the important work that you're doing, and obviously some of the key insights that are emerging from that work. So thank you so much, Donna.
Thanks, everyone, and my apologies for having to leave.
No worries, no worries. Okay, we'll move into the next section, and I'd like to introduce you to Hayley Bowman. She's a specialist housing worker with Wellways housing programs, and she will talk on the doorway service. So over to you, Hayley.
Thank you. I'm just sharing my screen. That's all good. Okay, thank you, everyone. It's good to be here today. First of all, I do just want to acknowledge the traditional custodians of the lands on which we all meet. I am working from Wathaurong country, which stretches from Ballarat in Western Victoria down to Geelong and the Bellarine Peninsula. I'm in Ballarat, and Ballarat is a Wathaurong word meaning resting place. I want to pay my respects to elders past, present and emerging and anyone in the room today. I also want to acknowledge anyone who has a lived experience of mental health issues and or homelessness as well. So we're looking at the role of private rental in reducing homelessness and mental ill health. Throughout this presentation, I hope to address some of the concerns and common questions that we often get when we're advocating for private rental as a pathway out of homelessness. So I hope to kind of address those as we go, but I'm absolutely happy to take questions at the end as well. So I'm going to start off giving an overview of our doorway program, just to provide some context. And then I want to speak to some of the key elements of that program and what makes it work. And then look at some of our data of private rental in numbers. And then I want to finish with a short video from a person with lived experience of doorway and from one of the agents that we work with as well. So Doorway is a specialist private rental housing and recovery program. So over 13 years ago, Wellways wanted to address the gap between people experiencing mental ill health and housing instability and homelessness. We wanted to specifically target this group using a housing first approach. And to do this, we consulted with Dr. Samson Barris. So for those of you who don't know that name, he's the founder of Pathways Housing First model over in the US. So we consulted with Sam to ensure kind of fidelity to this model. And so Doorway aligns with that Pathways to Housing model. Our program principles are around choice, social inclusion, sustainability, communication and collaboration. I want to clarify the sustainability because while that does speak to affordability, it also speaks to that wraparound support and that holistic support that helps people sustain a tenancy as well. Our Doorway program has housing and recovery workers, and I'll explain a bit more about them in a few minutes. But they are tailored tenancy and recovery support workers. They provide weekly support to people once they have found them a secure tenancy. Doorway uses an integrated team approach. So we work very collaboratively with clinical mental health services, and we support the individual to design their care team for what it is going to work for them, what they want in there, and who they want in their care team. We have the clinical team involved for about 6 months, recognising that recovery fluctuates, and that particularly within the first 6 months of someone moving into a tenancy, that's when things can start to unravel a bit. So we want to ensure that they have that continued mental health engagement on that level. So accessing private rental, participants pay 30% of their income. They pay their Commonwealth Rent Assistance, and then Doorway subsidises the gap for the length of the program. The program also uses landlord incentives, so we offer the landlord insurance, surety funds, that kind of thing. But to be fair, they're barely used, and the landlords rarely take it up. The program also offers brokerage, so we can pay a bond loan for someone, we can help them with their rent in advance, establishing their home, so for furniture and white goods and that kind of thing. We have found though that a lot of quite a few participants will want to save up by themselves for the rent in advance or for their bond, helping them kind of take ownership of their tenancy. So Doorway is an 18-month program, and the reason for this was that in our original, the first iteration of this program, it went for 3 years. So we worked with people for 3 years, and we found that it was starting to create a bit of a dependence on a service. So in reevaluating this and speaking with participants, we changed it to 18 months with the goal of the program being for people to be able to live independently and exit the homelessness service system by building those informal supports and networks. So Doorway has undertaken an evaluation in its inception, so after the first 3 years of the program. And then since then, it's been the subject of a couple of research papers which have been evaluating the impact of Doorway as well. So I just wanted to provide some demographic information. So firstly, looking at the experience of homelessness of the participants that have worked in the Doorway program. All this information is from 2017, and whilst we work on the Chamberlain and Mackenzie's definition of homelessness, so whilst primary homelessness is 5% in this image, we're noticing over the last few years that it's becoming more apparent, particularly in our regional areas, as they don't necessarily have the infrastructure or the crisis infrastructure that the inner city areas do. Secondly, looking at the experience of the mental health of our participants, we really wanted to target people experiencing severe mental illness, and I think this gives an idea of the conditions that people in Doorway live with and experience. So coming to some of the key elements of our Doorway program, one of the crucial elements of this is our housing and recovery worker role. So this is an intentional role that combines tenancy and mental health recovery into one specialist role. And by doing this, we created one key worker role that supports the individual to access cross sectors, to go across sectors which are traditionally siloed. In our evaluation, this role was found to be one of the key elements in supporting people to sustain their tenancy. So there's two things to consider here is how we recruit to this role and how we train for this role. So when thinking about recruitment, we found that people from a community services background work really well in this role. They bring a broader skill set to the role. We also kind of look for people who have strong stakeholder engagement and management skills. An essential part of this role is developing partnership with real estate agents. And a lot of that requires diplomatic but assertive approach, particularly when it comes to the negotiating and advocating on behalf of our participants. So thinking about the training, how we train people in this role, we make sure that they're trained in our outcome measures and screening tools that support mental health and AOD recovery. We train them in our sustainable tenancies training, so which looks at delivering housing support through a recovery lens and using housing first principles to guide and inform their practice. Staff will often look at the training in the Residential Tenancies Act, which comes out occasionally. They do trauma-informed practice, and they also look at some of the recovery frameworks when delivering their support. So CHIME is one that we work with as well, and we try and encourage our staff to build their natural supports around them. So an example I've got of how this role really kind of impacts tenants and navigates across that sector is that we had fairly recently, we had a participant who had quite a long history of rough sleeping. He was rough sleeping with somebody. They wanted to find a property together. So we worked with him and we found them a 2-bedroom property and secured their tenancy. very kind of familiar story. I'm sure you'll identify that, you know, after a couple of months of being in the tenancy, they started to unravel slightly. They started to bring visitors over that caused an incident. There was quite a violent incident that required police intervention, that kind of thing. Disturbed the neighbours. Neighbours complained. The agent issued an immediate notice to vacate. And this kind of speaks to some of the points that Donna was talking to around, as well, around the rights and responsibilities around the agent. So when we kind of looked at the immediate notice to vacate, we questioned the legitimacy of it. The worker was able to get legal advice and just kind of run it past someone who advised that absolutely would not stand up in VCAT. So the worker was able to use that and have a conversation with the agent to advocate for them to withdraw the notice to vacate. As part of that, they proposed to the agent the supports, increasing supports for these two tenants, and the agent then withdrew the notice. And the worker has also been able to work with some of the neighbours and had conversations around neighbours, and they've relayed those conversations back to our participants, which has given them a better understanding of the impact they are having on their neighbours, and that kind of thing. So it really speaks to those rights and responsibilities from both the tenant's perspective, but also holding the agent to account as well. So one of the second key elements of our program is developing partnerships with the real estate agents that we work with. So Doorway is endorsed by the Real Estate Institute of Victoria, and this endorsement has really supported our engagement with real estate agents. One of the key things that the REIV spoke to when we first consulted with them was that tenancy managers really want a point of contact for people. So this became one of our selling points, is that the housing part of the housing and recovery worker can really offer that point of contact for the agent. And we've been able to offer some training opportunities for tenancy management, excuse me, in how to support people with mental health issues along the way, which supports management of other tenancies. Agents don't just work with people experiencing mental health who have supports. They are everybody, lots of people in the community, whether it's diagnosed or undiagnosed, they work with people. They have people in their properties that experience these things, and often they don't know how to manage it, and often they will just go down the issuing notices or breaches and that kind of thing. So we've been able to kind of work really collaboratively with some of the agents to offer them this kind of skill set as well. An example that kind of speaks to that as well is one of the agents that we were working with called a worker and advised that our participant was packing up and leaving and looking like they were vacating the property. And they weren't actually doing that out of concern that they were abandoning their tenancy or the property. They were concerned about their mental health declining, and they were requesting that we could make contact and reach out to them, which we were able to do, and we were able to kind of intervene early, and the person was able to sustain that tenancy and live there. So it really kind of speaks to that collaboration between the two, and the agent being able to recognise that they weren't just moving out and making that choice, that actually they were concerned that their mental health was declining and impacting on their decisions. So it's interesting to hear from Donna around the Residential Tenancies Act. So I want to kind of speak to some of the changes that came to effect here in Victoria in March 2021, which has seen some interesting shifts. So one of the things that's been important for our participants is that they have gotten rid of the no pet clause. So this is no longer valid in lease agreements. And so tenants now need to request the permission to have a pet, and the onus is on the landlord to then make an application to VCAT to reasonably decline this request. And if they don't do that within 14 days, then consent's been given. And that's a huge difference, allowing people to have pets in their home, particularly, you know, we know the value of that for people that we work with. One of the other big changes as well is that rental providers now must give a reason for issuing a notice to vacate. So the 120-day notice to vacate no longer stands. And the other one is around minor modifications. So picture hooks, alarm systems and security cameras, as long as they're not hardwired into the property, they can make these minor modifications, and the landlord can't refuse them, which goes a long way to making that you know, a home feel safe and secure for people as well. So I just want to show you some of our data over the last few years, so from 2018 to 2022. So this is the average months it takes to house people in our program. And I know WA had a very different experience of 2020 to what we did here in Victoria. So I'm going to assume I don't need to explain the spike in the number of average months to house someone in the year 2020. But on average, you can see it takes 3.7 months. Prior to 2020, our average was 2.9 months of inspections and applications and things like that. So average inspections before getting a house is 6. And then if we look at, so I kind of purposely picked 2020 and 2021, particularly because they were some very extraordinary times in Victoria, particularly. And I wanted to show some of the vacancy rates and that we will still be able to house some of our participants in those areas. I do just want to explain that the vacancy rates actually went up in the inner east of Melbourne. And we put that down to a number of reasons, but a lot of people were moving away from inner city and going for that tree change. And also the demographics of those kind of areas were more the younger population who were probably experiencing job losses in hospitality due to lockdowns and that kind of thing, and were moving back to family homes as well. So there was reasons behind those vacancy rates in that particular area. Again, similar story in 2021 as well. Again, I'm sticking with those years. So some of the key outcomes during these years as well, and ones to consider, particularly that reflect the goals of the program, are around managing tenancy and accommodation. People were experiencing a much more an improvement in how they manage their tenancy. Emotional and mental health, and social networks and relationships are really looking at those community connections as a way of supporting people to sustain tenancies and connect back to their community. In 2017, we created this media campaign that was based on busting some myths around people experiencing mental health issues and also around the private rental market. So I kind of want to update some of these. So the first myth is saying that people who experience mental illness can't manage a property, which we know isn't true. And the way we busted that was that we can say that we've now housed or supported over 200 people to secure a tenancy and maintain a tenancy. Myth number 2 is that real estate agents don't rent to people who experience mental illness. We've now engaged with an upward of 100 real estate agents and supported them to look at different ways of supporting people with mental health issues as well. And then the other myth is around real estate agents are driven by money and not people, and are not willing to rent to people on low incomes, that kind of thing. So this again speaks to that the importance of that partnership with agents. So having developed those partnerships, they started approaching us with vacant properties before they even went to the market. And there was a couple of reasons for this. That A, they wanted to find a good match for that property. It kind of speaks to, it wasn't just about the highest amount of rent for that property. They wanted a good match. They wanted a long-term tenant in there. And also that they could see the results that Doorway was getting with other participants. So I do just want to share Tash's story with you. She's one of our previous participants, and this also has one of the agents that we've worked with as well.
I was diagnosed with bipolar. I had a psychosis, and about a year later, I entered the Doorway program. They helped me turn my life around.
Housing is so important to individuals. It's an essential human right. There are a lot of barriers for individuals who have mental health issues to access housing. The Doorway program was funded by the Department of Health, and it's funded to support individuals who have mental illness, who are experiencing homelessness. We support people to find housing within the private rental market, and we support them for an 18-month period within the community. Doorway is delivered by Wellways Australia in partnership with 4 hospitals, and we also work in partnership with a number of real estate agents in the community.
Having somewhere to live is the most important thing. When you don't have that, then everything else around you becomes unstable.
Most people coming into accessing homelessness services or experience mental illness might be accessing housing services such as public housing, community or social housing. Community housing projects such as Doorway are essential because it actually takes the pressure off those types of public housing wait lists, and it's essential for people to actually be able to access housing faster.
So I work with real estate agents a lot, everything from helping participants fill out tenancy applications to actually phone calls, face-to-face contact, advocating on the behalf of participants, but more often than not, getting wonderful feedback from real estates about how awesome the participants are in their houses.
It's not enough to just find a house for someone and close the door and say goodbye. Support is essential for individuals in the Doorway program. We need to be giving people the skills to be able to manage themselves. And there's also some advocacy that we need to do to the real estate agents around how to best support individuals who have mental health issues to sustain private rental. We don't want people to be in the mental health system forever, and actually our job is to do ourselves out of a job.
Some of the outcomes we see from the people using Doorway is that we do see them out in the community a lot more. When they first started, they would be quiet and a little bit withdrawn, but we are often now seeing them down the street doing their own shopping, coming in and seeing us, paying their own rent and doing all those kinds of things. It's great to see their confidence grow, and I believe we're changing people's lives.
Since being in the Doorway program, I feel like I've become more hopeful about things and more optimistic.
I apologise, I think I flicked through some of the screens there, so I'm sorry about that. So the agent in that video, Jess, wrote a blog for us around her experience of Doorway and working with some of the participants. So I just kind of want to share some of the quotes from that blog. The property management industry is not just about leasing homes for big investors. It's about placing suitable tenants in suitable homes and ensuring they have the support they need to succeed. The next quote, she's speaking specifically to her experience of one of the participants and of Doorway. The support this participant received from the case managers at Doorway was amazing. They helped him through every step of the moving in process, furnishing his house, arranging to set up rental payments, helping him maintain rental payments. The first inspection was done at 3 months, and when meeting with the tenant at the property, he was beaming with pride at how his home was kept and how much he loved being in his own home. And I also just wanted to share a couple of quotes from our actual participants. So choosing where not to live has been as important as choosing where to live. And I think that really speaks to that choice and self-determination in a sustainable housing pathway. This is my favorite quote. We use this a lot. I'm now like everybody else. I have my own place on equal terms, on equal footing. I have an address. I have a home to go to in the evening. I can cook my own meals. I'm not different. I may have a mental illness, but I can lead a normal life. So I just want to finish up there and say thank you and happy to answer any questions.
Thanks, Hayley. Thanks for sharing that. Some really useful insights, and the program is almost 10 years old now, isn't it?
Yeah, it's over 10 years. I think we're on 12 years now.
Oh, 12 years. Oh, there you
so,
go.
yeah.
So obviously great learning during that time. So we're going to have an opportunity to have a couple of questions at this point in time. So I'll just hand it over to the audience, either here or online, if anyone has any questions of Hayley and the Doorway program. No, very comprehensive. Thanks, Hayley, for sharing some of your thing. I have a quick question. Do you have a percentage of sustainment, the number of people or percentage of people that sustain their tenancies beyond, like a 12-month period?
I anticipated this question. And we don't actually have formal data, so I can provide anecdotal. So after we got some of our helpline volunteers who work for our organisation to contact people post 12 months of the program, and most of them were either in the tenancy that they got through Doorway, or they'd secured a different tenancy, so we're still in private rental. We also looked at the bonds that we paid. So we didn't pay for all of the bonds of all of our participants, which is where the data is a bit skewed. So we looked at the bonds that we'd paid, and over 60% of those were still active after a number of years. So that's a really interesting piece of data that we are starting to look at now and develop, because it's really key.
Right.
John, there's not a question, but there's just a comment from Leanne B. She just says, what a fabulous program, well done. And Shannon Young, thanks, Hayley.
Thank you.
So yeah, anyone online who wants to unmute and ask a question, I'll offer that to you now. Otherwise, we'll go over to a question here.
Hi, I was just wondering how you went about getting real estate agents on board, convincing them to be a part of the program, and what challenges you have in keeping them on board or getting them on board.
So we started off with a package that we would almost kind of like a marketing package. So we had information about the program, which provided information about what we could offer the agent in terms of that point of contact support, what we would offer the landlord in terms of landlord insurance. They could take that up if they wanted to. We also had a surety fund of like $1,500 if there was to be any damage and that kind of thing. We're reviewing that at the minute because it really highlights risk. So we're reviewing in how we kind of relay that information to agents at the minute. And like I said at the beginning, they rarely took the the money up. The other thing is around, we started off going into agents, and it spoke to that part of the worker role around being able to sell something. So they had to go into agents and actually sell the program, develop those relationships. They went into some of their team meetings to describe Doorway. And like I say, offering those training opportunities, which could assist them to then support other tenancies that they may be managing that don't have those supports connected to them. So really kind of upskilling them as well and supporting them in that process. Once we started to get landlords on board and we started to get agents, a lot of them see the difference and see the impact that it has. And will, like I say, they now come to us and offer us properties. So it's really a building process. It's about developing a partnership. There's some things that, you know, we have had people who have damaged properties, you know, but this doesn't come without some of the you know, I can tell lots of positive stories, but, you know, some people do go through those challenges as well. So there are some people who have damaged properties, and we've been able to work quickly with agents to kind of rectify that, pay for some of the damages and make sure that that happens quickly so that they can turn over the property quickly. So really kind of working with them through the good things and also the not so good things as well, so that we can, yeah, work together to kind of build that and maintain that relationship with them.
Just a question, Hayley. Colin Pinter from WAAMH. Could you just say a little bit about the role that the public mental health services play and how that role interfaces with the housing recovery workers?
Yeah, so our housing and recovery worker co-locates in the clinical mental health service. So it's attached. We partner with the 4 mental health, clinical mental health hospitals in different regions. The housing and recovery worker role sits and co-locates in that space. So they're able to support the team identifying people experiencing homelessness who maybe aren't ready, and those kind of explore those kind of conversations and say, actually, you know, we think you should do a referral to our program. And so we can help them navigate appropriate referrals and that kind of thing. We also then work collaboratively with, when we have have new referrals, we work collaboratively with the mental health team and the clinicians around, we might do joint visits to the house and support that participant in that recovery space as well. Like I said, I kind of mentioned, we like to try and keep the case management team on board for 6 months. Some leave earlier, and that's okay. But we have a plan. We like it to be, you know, a staggered kind of discharge, so that it's a planned discharge. We know what's going to happen, and a lot of people will then be managed in the community, so they will be then managed by their GP, and that's the ultimate aim, is to kind of get people out of these systems like the homelessness system and the mental health system.
That's great, thank you. I think we might just, we're going to have more questions and answer at the end. So, but look, let's thank Hayley for her time and her presentation this morning. Much appreciated. And hopefully you'll be able to stay online for the rest of the session. We might just have a 2-minute break just to allow to set up for our local presenters who will speak. Okay, we'll make another start. Thank you for that. So I now have the pleasure of introducing both Matilda and Daisy from Red Cross, who are with Red Cross and run a private tenancy support program. And so I'll hand over, I think, to Matilda to come and talk about that program.
Thank you, John. Before we start, we'd also like to pay our respects to the traditional custodians of the land that we're meeting here today, past, present, and emerging leaders. Thank you. So as John said, we're from the Red Cross. I'm Matilda, and this is Daisy. So the Red Cross Private Tenancy Support Service assists individuals and families from Claremont. So we operate in the metro area here in Perth. So from Claremont to Two Rocks in the north and as far inland as Dutch to stabilize their tenancies through a supported referrals process. So the tenancy support officers that we have provide a strengths-based case management, early intervention, and a holistic approach to support the tenants that we work with. So PTSS is funded by the Joint Commonwealth State-Funded Homelessness National Partnership Agreement. I should have said at the start that PTSS is split into 5 different areas in the metro area. We provide support in the Northwest Metro, Centre Care in the Northeast, Uniting WA in the central area, Ruhr in the Southeast, and Anglicare in the Southwest. So the referrals process through to the Red Cross can be made calling the number there, 922-58844, or emailing us on that email address. The intakes and assessment process. So agencies can refer on behalf of their clients, or also individuals can contact us, contact the service directly themselves. So a tenancy officer will complete the intake over the phone, and during that time, during that call, a suitable time for initial home visit is made. 2 staff members will attend the initial visit and complete the assessment. It's during the visit that we'll gain a better understanding of what the client's situation is, what their needs are, what the underlying issues that they're experiencing. The service and supports PTSS are able to provide are clearly explained, and the tenant's expectations of the service discussed during that initial home visit. An action plan is then developed, and the tenancy officers will identify and work with the clients to develop their strengths, transfer and apply these skills to challenges and issues they are currently experiencing. Tenants are provided with a support pack, and in this pack, there is information on financial management, money-saving tips, emergency relief agencies who can assist with other bills or other supports they're needing, where they can access legal assistance and other useful information. So we work quite closely with tenancy legal advocacy services. If there are, some of our tenancies have come to us at a point where they're going to court, or they've received breaches or termination notices. So particularly for us in the Northwest Metro, it's the Northern Suburbs Community Legal or Circle Green that we'll be referring our clients to. At that initial assessment, a client action plan is developed. And this plan will then identify what the client's capabilities are, the opportunities available to them, what the grid outcomes are, and the responsibilities and the resources required. So this is the responsibilities of both the clients and the service. So clients can engage with us for up to a period of 4 months. However, this is flexible depending on the needs that they present with. These are some of the ways that we can assist the clients. Referrals for financial counseling is something that we strongly encourage them to do. Assistance with nutrition and food budgeting. We have links with food providers, food services in the area. So our volunteers can also pick up food or transport our clients to access these food services. There is education or training costs. So we have brokerage that we can utilize to sustain the tenancy, whether that be through rent arrears, utilities, any training or educational costs that they may require if this is going to go towards sustaining that particular tenancy. We also have capacity to assist with medical or dental needs. We can provide assistance with transport to medical appointments, meetings, job interviews, accessing government benefits, and linkages to other local community services. So like I said earlier, we can work with our clients for up to a period of 4 months. Again, this is dependent on the needs of the client. We have worked with clients up to a year and a little bit more if there is a need. Towards the end of the support, we will slowly fade the support out developing an exit plan that's suitable for them. The focus for us is to secure a tenancy for 12 months and also to refer to other organizations for ongoing support, determining any ongoing needs of the client and the outcomes for PTSS and the client. We're funded for 90 clients per year. We do exceed these numbers and can support up to 120 families or clients per year. In the previous 6 months, 1% of referrals were from mental health services. Approximately 10% of clients approached seeking assistance because of mental health concerns raised by their inability to stay in their housing or inability to find suitable housing. 31% of our clients had prior mental health diagnosis. That's the end of the slide. So I'll now introduce Daisy. So if you've got any questions, or Daisy might want to add a few things as well.
Thanks, Matilda. Need it a little bit shorter for me. So I guess what I wanted to add was that private tenancy support actually isn't a mental health program. It's a program to sustain anybody in private rental accommodation to hopefully maintain the accommodation that they are in, but equally find suitable accommodation within the housing framework that we have moving forward. So the numbers that we're seeing are anecdotal to the work that we do, but show there is a significant impact of mental health and housing and a connection between the two. And I think probably what's most impactful for us is that whilst 30% of our clients may have a mental health diagnosis prior to attending the service, it's the significance of individuals who are experiencing mental health because of their housing experience, rather than those who have a housing challenge because of their mental health. So for the 10 years that we've run the program, there have always been impacts between housing and mental health. Obviously, that has increased significantly in the past 3 or 4 years during lockdown and COVID and all the challenges that have come with that. But what we're really seeing now is that actually, because of the lack of housing, individuals who perhaps we wouldn't have considered to be particularly vulnerable entering the program, so perhaps they've had a relationship breakdown, they are experiencing an episodic challenge in their housing, are actually much more likely to then suffer from a mental health condition now, because the challenges in the housing market are such that finding an achievable and affordable private rental actually isn't possible. And what we're seeing as well is that the housing choices that people have actually are contributing to the mental health impacts that people are experiencing. So I think Donna touched on this earlier, but the impact of having to give your pet up, for an example, if you're choosing or if you're being forced to move into a new private rental. Most of our clients actually do have pets. And the impact of having to give that lifelong companion up to actually secure an accommodation choice, and probably or potentially not a choice that you would have chosen to make if there was choice available, is having real life impact on individuals. We're also seeing that because there is a lack of affordable housing, the housing choice that people are making, so the location that they're being able to live in, the amenities that are close by, actually don't meet their general life needs. And so that in itself is again impacting mental health and is contributing then to the challenge of maintaining and sustaining accommodation. So it's a really secular housing challenge that we're facing at the moment, and is something that private tenancy support is trying to navigate within what is fundamentally a private market. We are really lucky with the PTSS service that we provide, that we have really great relationships with real estate agents. And actually going back to the question earlier around how do you develop those relationships and how do you effectively take somebody that works in a private market and ask them to support somebody who from their perspective brings additional challenges as a tenant, what we've found is it's just having a conversation with them. So we've been able to go out and meet with private rental landlords and real estate agents and advocate for the work that we do in the tenancy space. And most real estate agents have been open and have worked with us well in that space moving forward. So I would definitely recommend, if you're working in this industry, just knock on some doors, because they really are open to supporting the work that we're doing. I think that's probably everything from us, but if you have any questions, we'd be happy to answer them.
Yep, no worries. Thanks for that, Daisy. Yeah, any questions from the audience? Yep.
Thank you for your presentation. I might have missed it, but I wondered if you could speak a little bit more to the profile of your clients that you've been housing, particularly sort of composition, family composition, but also anything around cultural and linguistic diversity.
So our client cohort is really diverse. So we work with obviously individuals who are experiencing housing stress. As we know, housing affordability for an individual on New Start or youth allowance is significantly challenging. So we have lots of loan applicants that are coming through, but equally we have lone parent families that we're working with who find it challenging to secure a rental because of the composition of the family dynamic and the perception of the challenges that that brings. So it's really, I wouldn't say we have a particular cohort that it's not particularly male or female, it's split approximately 50% across both genders, and yet the compositions are pretty equal. In terms of culturally and linguistically diverse, that cohort makes up approximately 15 to 20% of the clients that we support in the Northern Corridor as well. So that may vary depending on the locations of the PTSS service.
Can I, just on that issue, is there also, I thought is there a private rental tenancy support service provided by one of the multicultural providers in the, is that still the case?
Not that I'm aware of, not that we work closely with.
Okay.
Yeah.
Okay, I have a question from online, and this is actually for both Hayley and yourselves. For organisation operating these private rental programs, what is the cost to your organisation per year to operate? So do you want to respond first, Daisy, and I might ask Hayley to respond second.
So we are fully funded to deliver the PTSS program. We're funded by Department of Communities. I'm not sure that I can talk to the specifics about what that would look like, but we are a fully funded program for the 100 clients that we're funded to provide that program for.
And Hayley, are you able to share that information?
A very similar position. We are funded by the Department of Health, and as part of that funding includes the recovery worker, it includes the rental subsidies that we provide, and the brokerage and all of that. So it's a whole kind of package. I actually don't know off the top of my head what that equates to in terms of, you know, funding for one EFT, but I'm happy to kind of take that away, and if I can answer it, provide it at a later date.
Yep. No. Anyone else on our online audience that wants to ask a question? You can unmute and ask or put it through the chat. Yep.
Hi guys, thanks for the presentation. I was just wondering around your numbers. So the 90 funded people a year, and then you can up that to kind of 100. Do you find that that is enough to meet demand, or how does that kind of play out?
I think the answer is that there are always more clients that we could be supporting. We do try to have a no wrong door approach. So if we can't support somebody, we will refer them through to an agency who can. The 120, 130 seems to fit for the Northern Corridor, the types of numbers that we're seeing, because some people come through and we're able to provide some basic advice at the very beginning. So there's a breach notice been received, they're at termination, or they're seeking accommodation, and we will link them in with advocates, legal advice. We have a property manager's handbook and a tenant handbook that we provide to people as well. So sometimes we're able to support kind of in a very short-term capacity. but I think there's always more need for service delivery. So if there was more support, I think there would be more clients seeking assistance.
Hayley, do you want to make comment about the demands on the Doorway program?
I think we're slightly different because we're funded to support, I think, 50 people over an 18-month period, and so that's kind of constantly changing. Obviously, when someone's coming to the end of their journey, we'll start to pick up new referrals in that particular region. So it's a bit different in that respect. We're kind of funded for the, I suppose, the case management side of it. So it's a bit different, yeah.
Do you find though that the requests for entering the program outweighs what you're at capacity in terms of the demand?
Yes. I think that's just a straightforward, easy answer there.
And how do you manage that then?
I mean, we always try and work with, so we get our referrals from clinicians. So if we don't have capacity to pick that person up, we'll do a lot of secondary consultation. We'll kind of help them navigate the system as to what other services are out there at the minute that have capacity to take that person on. So we'll provide that kind of secondary consultation for that to try and fill that gap. But yeah, definitely demand is higher.
Sure. Okay. Any other questions from our online audience or here? All right. Well, thank you, Daisy, and thank you, Matilda, for your time and your presentation. There has been a request for the slides, and I know Hayley said that she's happy to share. We'll follow up with Donna, and I assume you guys are okay to share your slides from today. Yep, we got a yes, so we will send that out to everyone who's registered. I might ask Colin to go up to the front now and just make a few comments about where to now in terms of, you know, we've learnt a lot about various programs that are operating in this space. So I guess the question that might be on people's minds is, well, what's next, or where are we going with all of this?
Thank you, John. Can you, yep, that's fine. You can hear me okay. Yeah, can I just, on behalf of WAAMH, for those of you who don't know WAAMH, we're the peak body for the non-government mental health sector. I'd like to thank Hayley, Donna, Matilda and Daisy for their really excellent and helpful contribution to the session. Thank you so much. And also to John and Royston from the End Homelessness Alliance. I just wanted to make some general comments just to put in context sort of a bit of the background to why we're here today. Some of you may not be aware that actually the majority of people with with mental health issues actually live in the private rental market. And so that's there was a large piece of research done 2020 nationally by the Australian Housing and Research Institute, AHURI, and in partnership with Mind, which is a national mental health provider, which highlighted the significant role that the private rental sector plays in housing people with mental health issues. But the problem we have is that there are, as Donna pointed out, there are no funded mental health specific private rental support programs. You've heard about some of the programs that exist for people in private rental, but they're not specifically focused on people with mental health issues, or they're not funded or have the capacity to respond specifically to people with mental health issues. The Doorway program is really the only funded mental health private rental support program that operates anywhere in Australia. And that's why it's such an important program. We've been partnering with Wellways. They've run a number of events for WAAMH. The whole issue of private rental and people with mental health issues is a priority for WAAMH. And I think Daisy raised this issue. So we're talking both about people with an existing mental health condition in private rental, but what we're also seeing increasingly is the way the private rental system creates and accentuates people's struggles with mental health, even though they may not have gone into that private rental property with an existing mental health condition. In other words, the nature of private rental is often a driver of people's mental health issues. So what's important from our point of view is how we might begin to look at ways we can respond to those cohorts of people with mental health issues. As some of you will know, there are some funded mental health supported accommodation programs that the Mental Health Commission funds, but most of those focus on people in supported housing, transitional, public housing or community housing. There are no specific private rental mental health programs funded by the Mental Health Commission. So WAAMH's trying to address that issue with the Commission, and we have put a proposal to the Commission for a pilot of the doorway model here in Western Australia. So that's an ongoing conversation that we're having with the Mental Health Commission currently about trying to run a pilot program of the doorway program in WA. And that's something we'll continue to work for and advocate for. That clearly would involve the non-government mental health providers, mental health housing providers, and as you heard from Hayley, a significant role for the public mental health system and a significant role with private real estate agents. So we've also begun some conversations with those stakeholders about that. So hopefully that's something that we'll continue to advocate for. You've heard from people today that there are a range of other programs that support people in private rental, although mental health is not their primary focus. Some of those are funded through, as Daisy mentioned and Matilda, through the Department for Communities. I just found out another program operating in one of the refuges, which is trying to support women into private rental. I wasn't aware of that program, so it's great to hear about that one. So there are a range, and Donna mentioned the range of programs that also exist, from financial counselling, the tenant advocacy services that are within community legal services. And there's a range of other initiatives that really try to support people in private rental. So part of our work will be trying to find ways we can support those services in terms of how they can respond to people with mental health issues increasingly. So that's work we hope to do over the next 12 months. But I'm very keen to talk to anyone here or anyone online who would like to have a conversation about, opportunities for us to work together. The other issue that I'll touch on, Donna mentioned the issue of, and as did Hayley, the issue of the Residential Tenancy Act in Western Australia, which does, in a sense, because of the nature of that act, accentuate people's psychological and emotional distress. Any of you who are a tenant, and I'm a private rental tenant, will know the structure of private rental is very stressful for people, and that's partly as a result of the Residential Tenancy Act. So there's currently, the state government's currently undertaking, or has been undertaking, a review of the Residential Tenancy Act, and we're currently at a point where the responsible department has put a discussion paper out, and we're now at the point of trying to shape the state government's response to that review. And you would have probably seen stuff in the press around this. There is a Make Renting Fair campaign, which is coordinated by Shelter. And that involves a number of NGOs, as well as private tenants who are working in an advocacy sense to try and change the Residential Tenancy Act. So some of you may be interested in either being part of that campaign or supporting that campaign. And you can touch base with Chantel at Shelter about that Make Renting Fair campaign. The other issue, and I think there's a number of people here who've touched on it in your questions, is there are sort of some significant unmet needs in this area, and WAAMH will continue to try and address those where we can in relation to mental health. Certainly issues, so we've had some conversations around the issue of young people in the private rental sector and the impact upon their mental health. And another issue that's come up constantly, of course, is the impact on older people's mental health. And then you've got specific cohorts as well around Aboriginal people and people of culturally and linguistically diverse backgrounds, which I think a question was asked about today. So WAAMH will continue to advocate in this space. Very keen to work with anyone here or online who would be interested in talking with us. Part of the issue here is that I think, as both or every speaker mentioned, we have quite fragmented systems. So we have a separated housing, mental health and homelessness system, and then you have a private rental sector. So part of the challenge really is for us to try and bring together people across those sectors. And that's work that we try to do through the End Homelessness Alliance or through other mechanisms. So thank you very much for your attendance from WAAMH's point of view. Thanks to the End Homelessness Alliance for the chance to participate in this event. Thanks to the speakers, and yeah, very, very happy to for anyone to contact me directly, and I can see how we might be able to have a conversation about how we can address the needs of people in the private rental sector grappling with mental health issues.